As a lady trying to conceive, you must have heard about ovulation test. Now, what is ovulation test? This is a test that will help you, guide you to know exactly when ovulation is around. But one of the most difficult things is in the interpretation of this test, because it looks like pregnancy test, whereas it's different. Hello beautiful people, thank you so much for joining us on this episode of our health discussion. As you can see today, we are actually in the laboratory trying to do an explanation of an ovulation test and the interpretation of this test, and also comparing it with a pregnancy test. If you're clicking on this channel for the very first time, do us a favor, hit that red subscribe button and click notification. Thank you so much. For those who have been here, may God bless you. Please let us ride on and do this explanation together. So guys, now let us do this explanation together. Now, this is our ovulation test kit. This is our pregnancy test strip. Now, this is our urine. Actually, this is water. Reason being that we're touching a lot of gadgets and we are going to use this water as the control, since we already have the result that we are going to explain, but we're going to use this one to carry it out so that you'll see when the result will be out. So you get your strip, you get your ovulation test strip. So what do? You open your ovulation test strip. So we're going to open our ovulation test strip. Okay. Then you remove the strip inside. Now look at this. This strip, if you look at it, there is a wide window here. This is where your results will be interpreted. So the result of this test will be interpreted using what will come out in this window. So let us keep the strip. You take your pregnancy test strip, you do the same. You open, you remove the strip. So if you look at pregnancy test strip, you also have a window here. This window is also where the results will be interpreted. So our result will be shown in this window for us to interpret. So this is our sample, our urine. So what are you going to do? You're going to do the same thing what you're going to do for the ovulation test, the same thing you're going to do for pregnancy. So you dip this test strip in your sample. So you dip this test strip in your sample such that you have it immersed, and take note, it should not get past the level where you see max. Max means maximum. So you should not get past that level where you have maximum. So let us do it. So this is our water, and it's going to also help us for you to see much more better. I hope you can see. So you dip and you put inside for some few seconds. So it can be inside for about maybe 10 to 15 seconds, no problem. So you can remove. So you remove, you now keep your test strip to lie for 10 to 15 minutes. We are going to do same for pregnancy. So for pregnancy, you also have the level where you have the max, meaning maximum. So you don't have to put your test strip beyond the maximum mark. So this is your test strip. You dip in your sample, which is your urine. So you remove, and you also keep for 10 to 15 minutes. After 10 to 15 minutes, you're going to read the results. Now, while we wait for the results to come out, let us do an interpretation. Let us give why you have these two test strip dip in urine and what we are expecting. Okay, so what are we expecting? We are going to see that for positive, there will be two lines, and the interpretation will be different for pregnancy test as well as ovulation, because for ovulation, two lines doesn't suffice that you're positive. There is a certain degree of the two lines. But what I want to explain here is that when you have two lines, the very first line from the direction where you put the strip is called the test line, and the line furthest away from the direction where you put your strip is called the control line. This will actually be explained when the results are out. So stay tuned as we continue explaining our results. So our results are out, and look at this. This is for ovulation, and this result is purely negative. Why is it negative? It is not negative because it is one line. No. It is negative because only control line has come out. It is negative because you have only the control line. The reason why we are saying that it's not negative because of one line, because you can still have one line and that result is not interpreted as negative, it's interpreted as invalid. So this is negative because you have only the control line. How do we know that only the control line? Remember, I just said we are going to have two lines in this window, and the first line from the direction of the application of your sample. Therefore means, remember, we dip in through this direction. So the very first line that has to come out from this direction is called the test line. But the line furthest away is called the control line or the C line. So this is for ovulation. And for pregnancy, same, negative. For pregnancy, it looks like this. Only one line. Now, what is the difference? Remember, what I showed before was for ovulation, and that was purely negative. And it was purely negative because we are using water for demonstration. Now let us show you how ovulation will look if you use normal urine and pregnancy for someone who is positive as well. So this is ovulation. This is an ovulation result using a urine sample. And if you look at this result, you will be saying that, oh, it is a positive result. No. This result shows two lines. And as you can clearly see, there is a first line from the direction where we apply our sample. And this line, we call it the test line. And there is a second line away from the direction where we apply our sample. This we call the control line. Once you have these two lines, you don't just interpret it as positive for ovulation test place. If you're a lady watching, once you have these two lines, what you have to look at is the first line, what we call the test line. If this test line has the same intensity as the second line, which is the control line, then you can say that you have a positive ovulation test. So look at it. If you look at this, you'll see that this test line is less intense as compared to the control line. That is how ovulation test is interpreted. The test line should be either of the same intensity or even more than the control line before you consider it as being positive. So this result for ovulation, this particular result, this when you do it using urine, you will have two lines. Two lines does not necessarily mean you're positive unless the intensity of the test line is equal or more than that of the control line. Now for pregnancy, this is a positive pregnancy test. So you can have two lines. And if you look at the intensity of this pregnancy, it is almost the same. So if this was actually ovulation, then this will be positive ovulation test. I hope this is clear. So if there are any questions, please make sure you keep it in the comment section. So let me explain why we say for ovulation, the test line does not necessarily mean that you're positive if you just say it. And what is the implication if you are positive for ovulation? Does it mean you're ovulating? So let us explain that. So, if your ovulation test shows positive, and positive here we are saying that the test line is either of the same intensity with the control line, just like we've explained, or greater than the control line, then your ovulation test is positive. Positive here does not mean you're ovulating at the moment. Positive means you're going to ovulate within 24 hours or 48 hours. I really do hope that you enjoyed this. Thank you so much for following me. God bless you. Please don't forget to subscribe and click notification on our YouTube channel. May God bless you. Thank you. Keep safe.